Morning. I'm Dr. Ravishankar Bellala from Vishakhapatnam, and I'm the managing director of Omega Hospital. And I thank the organizers as well as the jury of International Popular Scientist Awards for selecting me for this award, Research in Excellence. Thank you very much. So today I'll be sharing some of my information on a study on the role of mutant p53, SLC7A11, crosstalk on the therapy outcome in oral cancer patients. This is a kind of an study which was done in an our hospital in Vishakhapatnam. So, as you know that the most common cancer in this part of the country is oral cancer. So, the reasons could be varies like from exposure to the tobacco, and basically most of them would have had history of chewing the tobacco in the form of paid or an gutka or a uh, kine. So unfortunately, many of these patients they come to us at a very advanced stage, and the outcomes are pretty bad. And perhaps it is one of the common cancer that we see in our clinic day in and day out. And if you see the figures, 1 in 33 men are affected with this cancer. And even in women, it is so common that 1 in 107 women are affected with this cancer. And on an average, you see that the incidence is something like close to 26 to 30 per 1 lakh population. And majority of these patients, they come to us with a very advanced disease. Despite of all the advances that we have in the form of surgical practices or radiation and the chemotherapy, the overall survival it tends to be always fall between 40 to 50%. So we thought that there is definitely a need for us to really look into this cause and try to elucidate the molecular pathogenesis to develop, if possible, the novel strategies to overcome this kind of an phenomena. So one of our major thing that we looked at is SLC7A11, which is nothing but the solute carrier forming seven membrane protein, which is responsible for influx of cysteine, and there will be an export of glutamine. So it is basically an important factor which plays a vital role in antioxidant function, for apoptosis, and the nutrient deficiency of the cell, and the tumor microenvironment. All these things are perhaps very much controlled by this SLC7A11. So that is one reason why we looked at this. And we also feel that there is a lot of correlation between the tumorigenesis, proliferation of and the metastasis, a prognosis, and finally a chemo and radio resistance caused by these kind of mutations which are in SLC7A11. So our objective was to analyze and correlate the expression of p53 and HAF alpha with the tumor relapse and recurrence in oral cancers. And our second object was to elucidate the effect of p53 and is there a crosstalk between SLC7A11 and p53. This is something very interesting factor that we wanted to look at. And the third objective is to determine the effect of inhibition of SLC7A11. Is there any benefit you achieve by doing all this? So coming to the objective one, we analyzed and correlated the expression of p53 and HF alpha with tumor relapse and recurrence in oral cancers. And we collected IHC blocks from our hospital repository, and we retrieved the data, and we have done an immunohistochemistry analysis of these patients, and we have done this IHC within microarray analysis, and we got this validation through an RT-PCR, and we have done a statistical analysis. So coming to the material and methods, it was carried out in our hospital, that is Omega Hospital, Visakhapatnam, and we have done about 155 samples were retrieved of patients suffering from oral cancer, which were confirmed by an histopathology. So all these patients had undergone surgery and they had required adjuvant treatment in the form of radiation or a chemotherapy. And they were treated as per the guidelines from the any consensus, like it could be an NCCN consensus or an ASCO or an ISMO recommendations. As per the recommendations, these patients were treated. And then we started collecting the samples from these patients, those who had undergone surgery, and the specimen was fixed within 10% buffered formalin, and they were crossed as per the HSCC guidelines. After fixation, 4 to 5 micrometer sections were taken and they were given for an hematoxylin eosin staining, which is a routine practice that we do in our lab. After this histopathological examination was performed, we just look at some of the adverse features which are already been elucidated in many of the publications. That is a role of depth of invasion and extranodal extension and the surgical margins. These were the factors which were, like looked at a different way. Like, are there any correlation with this expression of p53, HAF alpha, or SLC7A11 with this? And this material was all the samples of these patients were spotted in a tissue microarray and they were submitted to IHC and just to see whether there's any expression of p53, a quantitative assay. And IHC assay was performed using Ventana, and it is an automated system. So, like it just go through the procedure as per the schedule. And p53 results were given in terms of either it's a wild or a mutant or a null type. When do you call this mutant is when there is a more than 70% of your p53 protein is mutated, then we call it as a mutant. If there is a 100% mutant protein expressed in a p53 IHC, then we call it as a null. So these are various parameters that we see and look at when we are doing this study. So you can see that this is the cutter for tissue cutting, and this is a microarray plate, and you can see this. There are some controls and there the tissue which are used. So you can see that a p53 very well less expressed, that is a wild type, and this is an expressed in a mutant type mutations of the p53. So by and large, if you see in our study that p53 mutant were about 58%, which matches almost to any of these international standards that what we see in other areas of the world. So of which null patients were about 32 and diffusely positive, that is more than 90 were 4, and diffusely positive with more than 80% was 54. So coming to the wild type, there are about 42% of our study population had a wild type p53. And if you see that like almost some of these patients had less than 10% of these patients had 10% mutation in 19 patients and 11 to 50% in about 25 patients and 51 to 79% in about 21 patients. So what we have noticed in our study is that there is a significant association between p53 expression and this T stage. I mean to say that p53 mutation. So what we found that the mutation was much more common among the tumors which had T3 and T4 compared to T1 and T2. So you can see that almost T3, 77.8% of these patients had a p53 mutation. And then T4, it is a T4, it is 77.8 and T3, it's 67.2. And significant association between depth of invasion and p53, which is statistically significant. So most of these patients who had more than 20 mm infiltration of the tumor, That means about 2 centimeter infiltration of the tumor in these patients who had mutant or in null expression. So that means which is a very aggressive tumor. And there is also a significant association between involvement of the margins and the p53. This is very peculiar and which is very, question raising for all of us. There are about 42 cases with involved margins. So the surgeons always they give some amount of normal margin and they remove the tissue in the normal margin, what the surgeon thought was also positive for malignancy. That means what you see on a naked eye is not the true. So there is some amount of malignancy beyond what you see. So that is what we were really surprised to see that in our study, majority of these patients who had mutant and a null expression had a positive margin. And this positive margin always carries a very bad prognosis in the sense that they have a very high chances of recurrence and the distant metastasis. So coming to the research methodology, that is true. We just looked at the effect of SLC7A11 on a glutathione axis on a chemoresistant and metastatic potential of oral cancer. The tissue was almost like we had done what is called a tissue sample collection. So here we wanted to see what is the molecular clinical pathological features that are really correlating between the expression of this particular SLC7A11 with clinical pathological features. So what we had done in our study was like we isolated the RNA, we had processed it through RT-PCR, and we assessed. You can definitely see the tumor here and the normal tissue and a bone, and this is actually the oral cancer of the oral cavity, which is involved in the lower alveolus. So here the paraffin blocks of these patients were collected, and we got 20 micron thickness uh, sections on these blocks. And what we had done was like we deparaffinized the tissue. That means we melted this buffer at 70 degrees Celsius to incubate, and we used a proteinase K, and we also used a binding buffer. Following which, the DNA is used to denature the DNA, and we just used a spin column and silica coated ones to extract the RNA. RNA wash was given, and 3 washes using ethanol with increasing the gradient of the ethanol. The percentage of ethanol was increasing, and we used elution buffer, and we spin the reagent, the material, and then we extracted the RNA, and then we converted that RNA into DNA by reverse transcriptase, and we used what's called goods buffer for this, and then we used random hexamers and DNTP free floating, that is ATGC, and we had done what is called a cyber green dye. So these are the primers which were used, and to our knowledge and to our surprise that all the patients who had p53 mutated and null tumors were also having a high expression of SLC7A11. So we thought that there is a crosstalk between these two. We're going to do further analysis of all these things and to come to a conclusion. Thank you very much. Stop sharing the